Good afternoon and Assalamu alaikum. My name is Syenz. I'm the CEO and the founder of Syenz Pharmaceutical Research and Development Lab certified by the FDA. With my 30 years of experience as a pharmaceutical scientist, a pharmacist, and also an engineer, it's a combination, I have dedicated my career for the improvement of the healthcare outcomes. Imagine for the customers, who are not finding the product of their choice, when they are going to the pharmacy shelves and struggling there for the OTC, cold, cough, allergy medication, and then they go back and forth between the doctors and the pharmacist. So based on our experience, we have segmented those customers or the patients into the three different categories or the groups. Millennials, who basically look for the holistic medicines, but they go back and come back, again for the conventional medicine because the minimum side effect is not the only thing. The relief is important, which they don't get it from there. The second one are the baby boomers. They come back to us initially by conventional thing, but they're not getting recovered fast, so they also look for the holistic medicines. And the third and the major group nowadays is those COVID survivors. Based on their experience, they want to use both of the medication at the same time, but there is nothing tailored custom available, so finally they end up using those separately. Among these challenges, we found a marketing opportunity for a combination product, which can satisfy all those three groups. So at the science laboratory, we have innovated and developed special formulations with the combinations for the children, adults, meeting the needs of all those three groups. All of those products are FDA registered and certified by the FDA and meeting all the quality and the efficacy standards. These are some of the herbal medicines which we're using in it. And the current products have all those categories. Again, from the competitive advantage point of view, the why we are, what Herbiomed is an investment opportunity. We have a portfolio of 6 international approved patents, which gives us the exclusivity in USA, Canada, Australia for our products, for the cough, cold, and those medications. Nobody can compete with that combination which we have. And besides that, we have our testing lab, which saves or supports the quality assurance. Other thing is our price competitiveness with the others, with the other manufacturers like that. There's a big company, Mucinex, Robitussin, Tuco. In our first launch from 2018 to 2020, we established the sales in almost 900 stores in the tri-state area. We sold around 15,500 units. We generated a revenue of $78,000. And in the beginning of the COVID, because we were getting close to the expiration of our product, we gave it almost 28,000 units for the community serving, and for which we got an unprecedented response for the efficacy of the product itself. We also completed our onboarding with the Walmart, Syenz, Amazon. You can see all of that here. Okay, it's on the other side here because I couldn't point it here. But anyhow, so what's our market share and opportunity? This is OTC market, which is a big market. Okay. And we basically operate in a $32 billion OTC global market, and out of that, $11.7 billion in the OTC of the cold and cough medication, only in the United States, with the 4.83% growth rate. We were a market because we have the patents in this area initially here. So today we are asking $4.7 million to support the manufacturing, marketing, and the sales of this product nationwide now. Okay. And based on our financial modeling, we demonstrate that we will be able to break even within 3 years. Then there will be sustainable and the substantial profitability profile going in. Within 7 years, we'll reach $14.7 million. This is our ask in the financial model. Finally, I say thank you, but I have to say something else once before. This investing opportunity is also a nation-serving opportunity. There is no FDA registered or established manufacturing establishment in Pakistan so far, as compared to India and China. Once this production will start happening in Pakistan, I can assure you to the nation that we will be able to compete with India. We will create the billions of dollars of the revenues compared to India. So this is not a small proposition. So if you guys will take it serious, this is also a nation-serving opportunity. Thank you very much for this considering the topic.
Thank you. That's very interesting to learn. I had one question. Have you thought about mass distribution and the strategy for distribution of your products throughout the country?
Yes, we do. That's what we are asking. That's what we are asking the investment for, because we initially did from 2018 to 2020 was almost 50,000 barrels first launch, where we proved our model and the marketing acceptability, which we proved it, and where people loved it. But only the thing, we did start our marketing strategy after putting the product out in the market, and any pharmaceutical has, especially solutions, liquid 2.5 years stability. So we did our best, we have a model that then we work more on the quality control in our lab. We are quality approved, completely certified by the FDA.
Thank you very much. So as a clinician, this is an interesting space where we look at evidence-based, in our approach. And so in this situation, the evidence for herbal and complementary medication is mixed. And the consumer clearly doesn't mind that. They're still buying the product. My question was, you said you have patents on this. Is that on the herbal blend that you have, or
it's
the components?
It's a combination, and when you make the two products together, especially pharmaceuticals when you combine the pharmaceuticals with the herbals, FDA wants to see that the original molecule is still stable for the shelf life. So our combination, when you are making tulsi and the sweet violet or the ginger or all those synergistic herbal medicines into it, they also want to see that there is no new toxicity generated, and there is no stability issues for the products, and they are good for at least for the shelf. So that's what our patents are.